Well, welcome. It's 11 o'clock. We will get started. Thank you for coming to the Mayo Employees Federal Credit Union presentation on Medicare. My name is Dave Brown. I work for the Minnesota Credit Union Network. We're the trade association for the credit unions in Minnesota, and we do advocacy work for credit unions and so forth. We started TrueLink Medicare Advisors 2 years ago to be able to offer Medicare options and advice to credit union members and really anybody who needs the advice. I've been in this field for 18 years, so I've been doing it for quite a while now. Anytime during the presentation, if you have questions, just raise your hand, or if you're online, just do it in the chat, and we'll try to address any questions as we go, and feel free to ask questions. This is very familiar to me, but it may not be very familiar to you, so if I say something that doesn't make sense, don't be afraid to stop me and ask a question about that. So again, thank you for being here. Disclosures. With federal government programs, there's always disclosures. In Minnesota, there are 7 Medicare Advantage insurance carriers. We represent all of those and can offer any of those. And then there's numerous Medicare Supplement and Medigap plans. We'll go over the differences of those, but we represent several of those, and then also standalone prescription drug plans that we represent. So the basics of Medicare. Our agenda today is why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? The enrollment periods and deadlines. What are going to be your costs associated with Medicare? What if you decide to work past the age of 65? Do you need to sign up for Medicare at age 65 or not? We'll talk about that. And then we'll take a look at private insurance options. So if you watch TV at all, especially in the months of October and November, you're inundated with Medicare advertising. And most of these are national, what they're called call centers, who do the advertising on TV, and they tell you all the free stuff that you may qualify for, and call them, it's urgent, and so forth. Because these are national ads, that a lot of that information doesn't pertain to what's offered in Minnesota. But once you call them, hopefully you don't, but if you do, they're going to get your information, and then they're going to pass it along to an agency, and they're going to keep calling you and calling you. So that's one of the reasons we were vetted by the Mayo Credit Union, is so that you can have a trusted source to work with instead of just calling some number that's advertising on TV or maybe something that you get in the mail. So our services, there's never a cost for our services. We'll be happy to meet with you face-to-face, or we can do a virtual call or over the phone, whatever you want to do. We tend to meet right here at the credit union if you want to meet face-to-face. And there's never a cost to that. We'll help walk you through the Medicare process. When you're ready to sign up, we can help you if you need help going online to sign up for Medicare Part A and B, or maybe you just need advice on how to do that. And then also signing up for the supplemental coverage will help you with that. When we do work with you on that, we're going to ask you for a list of your prescription medications and what doctors you see. We want to make sure whatever plan you choose that you're going to be covered. There's a caveat to that for Mayo employees, Mayo Clinic employees. If you're with the health system, this doesn't apply, but with Mayo Clinic employees, for most of those employees, if your employment started prior to 2001, the Mayo Clinic contracts with a third-party provider called Via Benefits. And they're going to let you know, your human resources person should let you know around the time of your retirement if you would be eligible to go through Via Benefits. If you are, we can sign you up for a plan, but if you use us, you lose reimbursement money that Mayo provides, and you don't want to do that. It can be significant each year. So, yes?
Does that apply to retirees as well, or just current employees?
I think, my understanding is if you started employment prior to 2001, once you're ready to go on to Medicare, whether you're retired or not, you would be eligible for that, and you would need to ask your HR person or someone in HR at Mayo if you qualified for the Via Benefits option. You would need to go through them. If you do qualify, you'd want to go through them so that you don't miss out on that reimbursement money. So what is original Medicare? Medicare has two parts that you get through the federal government. There's Medicare Part A and Medicare Part B. Medicare Part A, if you worked in this country for 10 years, you paid the Medicare tax, and you won't have a monthly premium to pay for Medicare Part A. Medicare Part A covers hospitalization, skilled nursing, home health care, hospice care. And then there's Medicare Part B that you will have a monthly premium to pay. This year, that starts at $185 a month. Once you sign up for Medicare Part B, if you're collecting Social Security benefits at that time, that $185 will be taken right out of your Social Security check. You won't even see it. If you're signed up for Medicare Part B, but you're not collecting Social Security benefits yet, you'll receive a quarterly statement. And on the first statement you receive, there's an option to sign up to have that $185 come out of your bank account every month. If you choose to do that, then that happens until you start collecting Social Security benefits. If you choose to receive the quarterly bill, then you'll receive a quarterly bill. I think that's $555, and you'll mail in a check to pay for your Part B benefits that way. Part B is going to cover the outpatient things like doctor office visits, specialist visits, ambulance rides, medical equipment, just a whole slew of things would fall under Medicare Part B. We have listed here deductibles for A and B. These deductibles don't apply if you have a Medicare Advantage plan, and depending on the type, if you went with a Medigap or a Medicare supplement plan, they may or may not apply based on the type of plan that you go with. So I won't go into a lot of detail over those, just because in most cases they're not going to apply to you, but you can just have original Medicare Part A and B if you want to. There's a lot of things you won't have covered if you were to do that. So original Medicare is medical insurance. It doesn't provide 100% coverage. It doesn't provide any coverage for comprehensive dental. It doesn't give you worldwide coverage, routine hearing exams or hearing aids, fitness benefits, routine vision exams or eyewear, outpatient prescription drugs. Parts A and B don't cover any of these things, which is why most people look at signing up for some sort of supplemental coverage to get coverage for these types of things. There's different Medicare enrollment periods. The first one is your initial coverage enrollment period, and it's based around the month that you turn 65 years old. The enrollment period starts 3 months prior to the month you turn 65, the month of, and 3 months following. So there's a 7-month window if you want to sign up for Medicare Parts A and B when you turn 65 that you would have to do that. If you wait until a longer time, maybe because you're still working and you don't need to, you can wait beyond that time frame. And that rolls us into the next election period. It's called the special election period. This begins 2 to 3 months before you're ready to leave your employer and retire, and it will continue for 8 months after that. However, you're probably not going to want to wait 8 months if you don't have insurance coverage once you leave your employer and retire. So with this, I get from a lot of people, they say, well, someone told me I have to sign up at age 65 or I'll pay a penalty the rest of my life. That's not true if you or your spouse is still working and you're on that employer's insurance coverage. As long as that employer has 20 or more employees, and if you're associated with Mayo, they obviously do, and their coverage is what's called creditable coverage, which Mayo's is, then you can delay enrolling in Medicare Parts A and B until you or your spouse retires and leaves that plan. A lot of people will sign up for Medicare Part A at the time they turn 65. You can, you don't have to. It's an option you have. You're not going to be penalized later if you delay A and B because you or your spouse is still working and you're on that employer coverage. Any questions? Yes?
Say Medicare, either Medicare A or B, you must pay for dental maybe?
What's that? You don't have to pay for?
Medicare, either Medicare A or B, you must pay for dental or vision?
They do not.
No?
No. So Medicare Advantage plans in Minnesota do. They're going to cover all those things. Some supplement plans will cover a part of that. some they won't. And we're going to go over that in a little bit, but that's a good question, yes. Then every year, once you're on Medicare, there's what's called an annual election period. This happens every year from October 15th through December 7th, which is why you see all the advertising on TV. And this is the time frame where once you're on a Medicare, either an Advantage plan or a standalone prescription drug plan, if you want to move from one plan to another, or you want somebody to review your coverage to make sure that your plan that you currently have is still going to be the right option for you next year, this is the time frame in which you would want to do that. If you decide, I'm happy with my plan, I don't think I need to have anybody review it, there's an enrollment period that runs January 1 through March 31st. And oftentimes what happens is the majority of people don't tend to have their plans reviewed every year, but yet the prescription drug coverage especially can change from year to year. So maybe your plan covers all your medications this year, but next year they can change and they may not cover maybe an expensive tier 3 like Januvia or Ozempic or something like that. You go to the pharmacy in January and find out, because you didn't have your plan reviewed, you find out that's not covered. I'm going to have to pay $1,000 a month for that. Well, Medicare came up with this, what's called the Medicare Advantage Open Enrollment Period, which gives you one more option if you're on an Advantage plan to switch from one plan to another to find a plan that is going to cover all of your prescription drugs. Delaying Medicare benefits, we've talked a little bit about this, but what about working past the age of 65? We can, if you choose to meet with us, whether you have to go through via benefits or not, we're happy to meet with you if you just want some advice. But we can compare the costs and benefits of your employer plan to Medicare. Most of the people I've worked with at Mayo or who have Mayo health insurance, you're better off keeping your Mayo insurance until you retire. It's more cost effective than going on to Medicare in a lot of cases. Mayo's insurance is deemed creditable coverage by Medicare. Also, one of the downsides, if you have an HSA plan or a health savings account with your health insurance with your employer, and you're 65 or older, you don't want to sign up for Medicare Part A. Once you sign up for Medicare Part A, you can no longer contribute to a health savings account. If you do, you're going to be taxed pretty heavily on that. So if you have an HSA account, you want to delay signing up for your Medicare Part A until you're ready to retire. The caveat to that is, if you're going to work past the age of 65, you'll want to, and you have an HSA account, you're going to want to stop contributing to your HSA account about 6 months before you're going to retire and sign up for a plan. It's not a huge penalty if you don't, but you would have incur some taxes on those contributions for the previous 6 months if you didn't do that. Any questions on that? Yes?
So I'm semi-retired and I contribute to an HSA plan.
Okay.
I'm trying to, I wouldn't be eligible until September.
Okay.
So and my actual full retirement will be May 1st. So should I be stopping those contributions, if I understand it, stopping those contributions now?
If you are signing up for Part A at age 65, it's not an issue. If you're beyond the age of 65, then yes, you would want to stop contributing.
Okay, well, I'm just 64 3/4.
Okay, so that rule doesn't apply if it's based around your 65th birthday.
Okay.
Yeah. Mm-hmm. Yeah, so stop contributing several months before. You can apply for Medicare Part A and or Part B online, and that's something that we can help you with. If you're not comfortable doing it online, you can go to the local Social Security office and they can help you with it. But the web address for Social Security to do that is ssa.gov for Social Security Administration, ssa.gov. And right on their homepage, there's an icon that says sign up for Medicare. And if you've created an account for yourself called My Social Security Account, it goes a little bit faster than if you don't, but you just have to enter more information if you don't have one of those accounts. But it's fairly easy to do online. It's a little more difficult if you've signed up for Medicare Part A already and then go to sign up for Medicare Part B. If you do that, there's something called the employer request for employment information. And this is a form Medicare provides that your employer's HR, they would need to fill out Section B, you would want to fill out Section A, and then everybody signs it. It doesn't take a lot of time, but this gets uploaded when you apply for Medicare Part B so that you don't pay that penalty for not having signed up at age 65. So if you're signing up for Medicare Part A and B at age 65, you don't have to worry about this form. If you're delaying that, because you're going to continue to work, you're beyond the age of 65, you'll need this form filled out by your employer at the time you're going to apply for Medicare Part B. And again, there's a way you upload that if you apply for Medicare Part B online, or if you do it at the local Social Security office, you just take this form with you. This prevents you having to pay penalties for not having signed up at age 65. Yes?
Does our employer most likely have that form?
They should. If they don't, I can certainly send you a copy. It's available on the Medicare website, but I can certainly send a copy. Most, if they're of any size, most do. Yeah.
So they're aware of it?
They should be. Yeah. HR tends not. Most HR people I've talked to do not like dealing with Medicare. And then there's impacts based on your income. So if you're lower income once you're retired, you can get extra help with Medicare. If you're higher income, you're going to pay a surcharge on some things. So the extra help is available to lower costs with Medicare Part B and Medicare Part D. These are the income thresholds for Minnesota for this year. So there's a column of family size, and then the percentages at the top, that's based on the federal poverty guidelines. So if you're at 100%, up to 150% based on your family size, if your income is under these amounts, you probably are going to qualify for some sort of extra help if your income drops once you're retired to these levels.
Could you explain what again with the 100%?
Yep. So the 100% would be if you're at 100% of the federal poverty guidelines, up to if you're at 150% of the federal poverty guidelines. If your income falls within those thresholds, you will probably qualify for extra help in some way of paying Medicare Part B and your prescription drug costs.
So 150% is the threshold?
That's the highest it would go, yes. Yeah, so say if it was just you, if you're at 150% of the federal poverty guidelines, if your income was $22,590 or less for the year, then you're going to qualify for some level of extra help. If it's over that, you're most likely not.
Okay, thank you.
Yeah. The alternative to that is if you're high income, there's what's called an income-related monthly adjustment amount. This is called IRMA, and they look at your taxes from 2 years ago. So for 2025, they'll look at your income tax returns, they being Social Security. They work with the IRS to look at your income tax returns, and they're going to look at your modified adjusted gross from 2 years ago. And if you file your taxes as a single person and your income was $106,000 or more that year, then you're going to have a surcharge added onto your Part B premium and your Part D portion of your premium. Part D is your prescription drugs. So there's 2 surcharges that would get added on. If you file your taxes jointly and your income was $212,000 a year or more, you're going to have a surcharge added on to your monthly premium. So you can see here in the columns, I'll point to this. So if you fall into these income categories, instead of paying $185 a month for your Part B, it goes up to $259, $370, $444. If you're in the highest income category, that $185 is going to be $628.90. Your Part D, for your whatever plan you sign up for, that's going to increase that by $85.80, depending on what category you're in. This is going to happen every month for the rest of the year, and then every year that gets reevaluated, and at some point during retirement your income drops below these categories, then you no longer pay the surcharges. It's not a lifetime penalty, it's year by year. Any questions on that? Yes?
Which number on the tax form?
Well, they make, nothing can be simple with the government, but they call it modified adjusted gross, which they're really the only ones who use that term. Most people just say adjusted gross income. They call it modified adjusted gross. That's a question for an accountant. But yeah, I don't know which line. Because typically, they don't have a line for modified adjusted gross. They have it for adjusted gross. So.
Modified in what way? I guess we can
Yes. So just want to make you aware of these surcharges if you fall into those categories.
2-year look back.
Yes. Yeah. And those thresholds tend to increase every year. Last year it was 103,000 and 206,000. So those thresholds for income does tend to rise every year. But so do the surcharges. Private health insurance options. So we have what's called Medigap or Medicare supplement plans. They've been in existence since Medicare started in the late 60s. There's Medicare Advantage plans. Those started around 2006. And there's Medicare Part D plans, which started around 2006. And we're going to talk about each of these. First is the Medigap or a supplement plan. Across the country, they're called, maybe you've heard people talk about, I have Plan F or Plan G or Plan K. We don't call them that in Minnesota. Each state kind of gets to set their own rules for Medigap plans. In Minnesota, they're called Basic, Extended Basic. We have copay plans similar to a Plan N. We have a high deductible plan similar to a Plan F. And the benefits never change on these, but the premiums can change. And the premiums do tend to increase every year on Medigap plans. With a Medigap plan, you can see any doctor that accepts Medicare. There's no network, so there's not a network you have to be concerned about, but any provider that takes Medicare will accept your Medigap plan. It travels with you when you're leaving the state or the country. The downside to that is Minnesota tends to have some of the highest priced monthly premiums for Medigap plans in the country. So if you move to another state, you can't just pick up a Medigap plan in that country. You would be asked health questions, and if you answered yes to any of the health questions, you're going to be denied. You'd have to keep the plan from Minnesota. But you can keep it if you relocate to another state. Medigap plans don't include prescription drug coverage. That's why we'll talk about standalone prescription drug plans. They also don't include coverage for dental, hearing, vision. A lot of them don't give you a free gym membership. Some do, some don't. But you have to, if you want dental and vision, you have to buy policies to add on to your Medigap plan. That's in contrast to a Medicare Advantage or a Medicare cost plan. In Minnesota, 21 counties still have what's called Medicare cost plans, but we have Medicare Advantage plans in Olmsted County. Goodhue has cost plans. We won't go into a lot on that, but with the Medicare Advantage plans, you're going to pay one monthly premium, and with that, you're going to get your medical coverage, prescription drug coverage, dental, vision, hearing, free gym membership. There's just a lot of extras that you can get with Advantage plans. Advantage plans do have a network of providers. And if you go online and read about Advantage plans, you'll get a lot of opinions. Some people think they're terrible, some people think they're great, but you're getting a national audience when you do that. Minnesota, I would argue, has the best Medicare Advantage plans in the country. While we have expensive Medigap plans, we also have the best Medicare Advantage plans. And the reason I say that is you have networks with Medicare Advantage plans. And in Minnesota, we have several carriers where 97% of providers are in network with Advantage plans. So that's not a huge issue in Minnesota, finding a plan where, an Advantage plan where your doctor is going to be in network. We have strong Advantage plans here. There are two different types of, oh, did you have a question?
I was just, when you said about the Advantage plans here in Minnesota, do they work outside of Minnesota, like when you're traveling?
They do. So there's two different types of Advantage plans. There's HMO plans, which I tend to steer people away from because they don't work real well when you're traveling. And there's what's called PPO, or Preferred Provider Organization. That's probably similar to what your employer plan is. Those will cover you all across the country. There'll be networks all across the country where you'll have coverage. So yes, the PPO Medicare Advantage plans will give you coverage all across the country. And they work great. The premiums start at $0 a month and they can go up to $150 or more. The Medigap plans, if you go with a Medigap plan where you just pay the Part B deductible of $257 and then you don't have any co-pays. If you're a non-smoker and you went with like a Blue Cross Senior Gold and you took the add-ons, that's going to run you about $310 a month. And you have to add on prescription drug coverage, dental, vision, if you want any of that. With Advantage plans, all of that's together into one monthly premium. So Advantage plans are more economical, but that doesn't mean that's the right thing for everybody. If you meet with me, or hopefully if you have to meet with Via Benefits, they're going to talk through what's important to you and what issues you're dealing with medically, and there may be a reason why you'd want to go with a Medigap plan over a Medicare Advantage plan. Minnesota did, I meant to talk about that on the past slide, but the Minnesota legislature has created an annual enrollment period for Medigap plans, and that starts in October of 2026. So next year, there are a few states that have been doing this. Minnesota has enacted it to start next fall. What that means is, let's say you start out with a Medicare Advantage plan in Minnesota because they're just more economical, but down the road you think, I'd really like to switch to a Medigap plan. Up until next fall, to do that, you'd have to be underwritten or answer health questions. And if you answered yes to any of those health questions, you're going to be denied the Medigap plan. Well, when in October of 2026, when that annual enrollment period begins for Medigap plans, anybody who wants to get into one is going to be able to do it during that time, October 15th through December 7th. It would start January 1 of the following year, and you won't be asked any health questions. So the Minnesota legislature made it a little easier for people, if they want to start out with one and move to another, it's not going to be a big issue starting next fall. That's brand new for Minnesota. You won't be asked any health questions on Medicare Advantage plans. So any questions on those?
So in Minnesota, which is basically, if I understood you correctly, starting in 2026, October of 2026,
They'll,
you can really move between different plans without having to be asked any health questions.
you can move into a Medigap plan without being asked health questions, yes.
So once I move into a Medigap plan and I want to change that, then would I be asked health questions?
Not if you do it during the annual enrollment
Oh,
period.
during the-
Yeah.
okay.
Yeah. Yes?
So Medigap is more expensive in Minnesota. Any idea why that is, since we have so much access to healthcare?
I don't know. I mean, I'm licensed in several states. I was working with a lady, a credit union member, who's moved to North Carolina, and she's paying about a third of the cost. She's paying about $130 a month for her Medigap plan. That's $310 here in Minnesota. I don't know why. Yeah. And then if you do go with a Medigap plan, if you want prescription drug coverage, which it's a good idea to have it, they're what called standalone prescription drug coverage. You would pair these with either a Medigap plan or a Medicare cost plan. I think the closest county to Olmsted that still offers Medicare cost plans is Goodhue County over in the Red Wing area. But you would want to pair up a prescription drug plan. There's different tiers of coverage. Tiers 1 and 2 are typically going to be generic medications. Tiers 3 and higher are going to be brand name medications or specialty medications. Some plans have a tier 6, and that's going to be the lowest cost generic medications. Not every insurance carrier offers that. If you don't sign up for a Medicare prescription drug coverage, whether that's tied into an Advantage plan or it's a standalone plan, if you don't do that when you're first eligible for Medicare, and that means when you're first going on to A and B, it doesn't mean when you turn 65, but when you first go on to Medicare Part A and B, if you don't sign up for a prescription drug plan at that time and you wait down the road, there's going to be a penalty that you're going to pay, and it'll be added onto your prescription drug premium, and you're going to pay it every month the rest of your life. So it's a good idea to sign up for some sort of prescription drug coverage. I've had many clients over the years who say, I don't take medications and I never will. as time goes on, I've helped them sign up for a Medicare prescription drug plan, and they wish they had done it earlier. But, you know, those are choices you have the freedom to make. There is a plan available in Minnesota, a prescription drug plan that has a $0 premium, meaning you don't pay anything a month for it. So you're better off to do something like that than to just say, I'm never going to take prescription drugs, so I don't need a plan. But again, that's your choice. And maybe you never will take prescription drugs, but that's your choice.
Some places vary in this situation.
Do they what?
Do they vary? Others
Oh.
charge and others charge?
Yes. Oh, there's huge differences in prescription drug plans, and that's one reason you want a broker to review your prescription drugs in helping you make a decision on what plan you go with, whether it's standalone or a Medicare Advantage plan. Some companies will cover all of your medications. Others will only cover some of your medications, depending on what those medications are. Some plans, like if you have a tier 3 medication like a Jardiance or Wegovy or Ozempic or something like that, some plans you're going to have to pay a deductible upwards of $450, and then you'll pay 25% of the cost of your prescription drug every month until you reach the cap that we're going to talk about in a minute. Other plans, you don't have any deductible on your prescriptions, and you'd only have to pay a $47 copay for that same medication. So that's why you want to review whatever prescription medications you're taking before you decide on what plan you want, because there can be a huge difference in what it's going to cost you by doing that. I had clients a couple years ago, and they had been on Medicare probably for 15 years. They signed up for the most expensive Medigap plan from Blue Cross, and they signed up for the most expensive prescription drug plan. When I reviewed their medications, people think because it's the most expensive, it's the best. The Blue Cross standalone prescription drug plan didn't even cover all of their medications. So I found a plan that did. They lowered, between the husband and wife, what they're paying to what they switched to. They saved $9,000 a year. And they were well-to-do, but still, $9,000 is $9,000. So you need to have somebody review things because things change over the years. Talking about the cap, new for this year, all medication costs will be capped at $2,000 per year. In the past, we had something called the donut hole. Maybe you heard about that. It's once your medication costs reached a certain dollar amount, you fell into this donut hole or coverage gap, and you had to pay 25% of the costs until the end of the year, you hit catastrophic coverage. That's gone away, and prescription drug costs are being capped at $2,000 a year. For most people, that's not a true $2,000. Especially if you're on a tier 3 medication, it's based on a national average. The formula is complicated, but for some people that I've met with this year, they may be on Jardiance and their copay is $47 a month, but because of the retail price of the medication, after 5 months, they've reached their cap of $2,000, even though they truly only paid $47 a month for it. So all of that information is available. We use the Medicare.gov website, and that tells you when you're going to hit your cap. If you are, it's based on the medications you're on. But this is a good thing that was enacted this year because people were paying thousands of dollars a month for their medications, and some people just couldn't afford that. So this just started this year. I believe it's a good thing. And then there's also what's called payment plans available. So for some people, if they reach their cap in maybe by April, and for some people they do come close to paying out $2,000, not for most, but that could be expensive going to the pharmacy every month and paying $500 to $600 a month for your meds. There's a payment plan available that it doesn't matter which insurance carrier you're with, they will send you information on that, and they will spread those payments out over 12 months instead of you having to occur it in 2 or 3 months. And if you choose to do that, then you're going to pay the insurance carrier instead of the pharmacy. So if you're in that situation and you sign up for the payment plan, You're going to pay your insurance company is going to bill you for your medications. When you go to the pharmacy, you're not going to pay anything for your meds. You're going to be paying your insurance carrier instead of paying for it at the pharmacy. And again, this is just something that's available to people who might be constrained financially and need a way to help cover that until they reach the cap. Was that totally confusing or understandable?
Is it gonna last? That's the big
Well, I hope so. I hope so. I think it will, yeah. But, you know, things could change, so I hope it lasts. And so this is what I just talked about. There's no cost to be a part of this MP3 prescription payment program. And if you're in that boat, and the nice thing is if you meet with us, we can tell you up front what your monthly costs are going to be, whether this is a good idea for you or not, or if you're in one of those situations where you're really not even coming close to truly paying out $2,000. But when we review your medications, we can tell you each month what your costs are going to be and when you're going to hit the cap if you do. So premium costs with Medicare and private health insurance options. So we went over Medicare Part A. You don't have a monthly premium to pay if you or your spouse have paid into the Medicare tax for at least 10 years. Medicare Part B this year is $185 a month. Medicare Part C, that's also called Medicare Advantage plans. In Minnesota, those plans run from $0 a month up to $100 or more per month. Medigap plans, if you get the least expensive Medigap plan, actually it's dropped down to about $60 if you get a high deductible plan, and it can be to over $300, and that premium will vary based on if you use tobacco or not. Medicare Advantage doesn't ask you if you use tobacco, Medigap plans will. And then with a Medigap plan, you also need to add on a prescription drug plan. And those can run anywhere from $0 a month to $100 or more, depending on the type of plan. So you can see if you go with the top Medigap plan and a top prescription drug plan, you could be paying $400 a year or more for a plan. If you went with a Medicare Advantage plan that had something similar, you're probably looking at less than $150 a month. But there's differences, as we explained, between the two plans. But I am licensed in several states, and I can tell you in some states I wouldn't want to be on a Medicare Advantage plan because they're just not that good. In a lot of states, the zero premium plans are very popular, and that means you don't pay anything a month for it. They're subsidized by the government, but you have high maximum out-of-pockets, you have deductibles, the networks are pretty limited. That's just not the case in Minnesota. We have really strong Advantage plans. We don't sell a lot of zero premium plans in Minnesota. Minnesotans tend to think if it's free, there must be something wrong with it. They're the most popular across the country. But in Minnesota, we have robust Advantage plans, and yeah, they're a really good fit for a lot of Minnesotans. And like I said, in some other states, I don't think I would go with one. But if I continue to live in Minnesota when I retire, I think I will. But again, it's an individual choice. So that concludes the presentation. You're welcome to ask any questions. The folder that you have, there's some handouts you can take with you. There's some common questions on Social Security, HSAs. There's a form in here. If you want us to be in contact with you about setting up a time to meet, yours may be white or it's gray, but if you fill this out and leave it with me, we'll follow up with an email. Thank you for coming. We'll ask you if you want to get together to meet or do a Zoom call, whatever you want to do. If you don't, that's fine. But even if you just want advice, I've met with a lot of people from the Mayo events who they need to use VIA benefits, but they weren't real confident in some of the advice they were given. So I'm happy to meet with anybody, whether you end up signing up through us or not, just if you want to compare our advice against if you got someone else's advice. But if you fill out that form and leave it with me, we'll send you an email. If you put your email address down, we will. We're not going to. I'd prefer to email you because you know how it is. You're at the store and somebody's trying to call you on your cell phone. But it's emails. You're allowed to respond when it's convenient for you. But if you want to do that and leave it with me, we'll be in contact. But here's our team here. Tammy, Tom, myself, Michaela, and Chris. Any questions on anything that I've gone over? Yes.
So we had one question come in online. What do they need to know if they live in Wisconsin?
Okay, so in Wisconsin, we're licensed in Wisconsin. Plans can vary a lot, well, they can in any state, from one county to the next. Plans are based by counties for Medicare Advantage. Medicare supplement plans in Wisconsin are a little less costs than what they are in Minnesota. Wisconsin has some good Medicare Advantage plans, but the networks aren't as strong as they are in Minnesota. But again, we could walk you through that and compare your options, Medigap versus Medicare Advantage, and help you decide what works best for you if you're a Wisconsin resident. Hopefully that answered the question. You should have my business card in the folder with my contact information on it, but I'll be here if you just want to talk to me personally. Maybe you don't want to ask it in front of the group, but if you have questions and want to talk to me, you're certainly welcome to. But I appreciate you coming today, and hope you have a good rest of the day.
Thank you.
Thanks.